While you are watching this video right now, somewhere in the world, someone has just lost the ability to speak forever. In the next 60 seconds, several more people will lose control of half their body. And almost every time, the reason is the same. No one recognized the warning signs in time. 2 weeks ago, I received a message I can't stop thinking about. A man wrote to me and said, "My wife collapsed right in front of me. I thought she was just tired, maybe dizzy. I waited 2 hours before calling for help. Now she's in a wheelchair for life." 2 hours. That was the mistake. 2 hours. Because when it comes to your brain, you don't have all day. You don't even have half a day. You have about 3 hours. After that, damage becomes permanent, irreversible. But here's what almost nobody tells you. There is a test that takes 10 seconds. 10 seconds. And those 10 seconds can decide whether someone walks tomorrow or never walks again. In the next few minutes, I'm going to show you how to recognize a stroke in 10 seconds, using 4 simple signs anyone can remember. I will also show you exactly what to do in the first 3 minutes, because most damage happens before the hospital even sees the patient. And finally, I will explain how to dramatically reduce your risk so this never happens to you or someone you love. Because the truth is this, nearly 80% of strokes are preventable. If you value being able to speak tomorrow, if you value walking tomorrow, if you value recognizing your family tomorrow, do not leave this video. What you are about to learn can save a life. My name is Dr. Michael Hayes, and there is something about stroke that doctors often fail to explain clearly enough, until it is too late. Stroke does not care who you are. A stroke does not discriminate. It does not care if you are 30 or 70. It does not care if you eat healthy. It does not care if you run marathons. Statistically, 1 in 4 people watching this video will suffer a stroke at some point in their lifetime. 1 in 4. Take a moment and think about 4 people you love. A parent, a spouse, a sibling, a close friend. According to the data, 1 of them will have a stroke. It could be you. But here's the part that changes everything. Your brain warns you. It sends signals. It begs for help. The tragedy is that most people do not know how to listen. What a stroke really is, in simple terms. Think of your brain like a city. The blood vessels are the roads. Oxygen and nutrients are the traffic that keeps everything alive. Now imagine one of those roads suddenly becomes blocked. No oxygen, no fuel. Buildings shut down, one by one, forever. That is a stroke. And every single minute you wait, nearly 2 million brain cells die. 2 million. Those cells do not regenerate. There is no reset button, no second chance. It is like burning pages from a book. Once they are gone, the information is lost forever. Those pages might control your right hand, your speech, your balance, your memory, your ability to recognize faces, including the faces of the people you love. The treatment that only works if you act fast. There is a treatment that can reverse this damage. It is called TPA. It dissolves the clot, restores blood flow, saves brain tissue. But it only works within a very narrow window, roughly 3 to 4 hours from the moment symptoms begin. After that, it does not matter. How good the hospital is, how experienced the doctor is, how much money you have, it is too late. That is why recognizing a stroke immediately is everything. And that is why you must learn this now, not later. 4 letters, 10 seconds, 1 life. Emergency neurologists created a system after watching thousands of patients arrive too late. They asked one simple question: how can we make stroke recognition so easy that anyone can do it, even without medical training? The answer became fast. 4 letters, 10 seconds. Let me walk you through it carefully. F, face. Look directly at the person and ask them to smile. If one side of the face does not move, if the smile looks crooked or drooping, that is not normal. That is a stroke. You may see one side of the mouth sagging, one eye not closing properly. This happens because the stroke is blocking the part of the brain that controls facial muscles. A, arms. Ask the person to raise both arms straight out in front of them, like they are holding a tray. If one arm drifts downward, drops suddenly, cannot be lifted at all, that is a stroke. The arm is there, the signal from the brain is not. S, speech. Ask them to repeat a simple sentence, something easy. The sky is blue. If the words come out slurred, mixed up, incomplete, or make no sense, that is a stroke. Often the person knows exactly what they want to say, but their mouth will not cooperate. This is terrifying for them, which is why you must stay calm and act fast. T, time. This is the most important letter. If you see even one of these signs, you call emergency services immediately, not in 5 minutes, not after waiting, not after giving water, not after giving aspirin. You call 911. Paramedics can start treatment on the way, alert the hospital in advance, take the patient directly to a stroke-ready unit. This alone can save 20 to 40 minutes, and those minutes often decide whether someone fully recovers or lives with permanent disability. One detail that saves lives. When you call, write down the exact time symptoms started. Take out your phone, look at the clock, write it down. This information is more important than almost anything else you can tell the doctor. Now let me tell you a real story that proves how powerful this knowledge is. Carlos was 52 years old, an engineer, a runner, no chronic illnesses. One Saturday morning, he was sitting at the kitchen table with his 19-year-old daughter drinking coffee. Mid-sentence, his cup slipped from his hand and shattered on the floor. At first, she thought he was just distracted. Then she noticed his face. Something was wrong. She remembered a short video she had seen weeks earlier. 4 letters. She asked her father to smile. One side of his face did not move. She asked him to raise both arms. His right arm dropped instantly. She asked him to repeat a sentence. The words would not come out. She did not hesitate. She picked up her phone and said calmly and clearly, "My father is having a stroke. Symptoms started 2 minutes ago." She wrote down the time. The ambulance arrived within minutes. The hospital stroke team was already waiting when he arrived. From first symptom to treatment, less than 1 hour passed. Today, Carlos walks. He speaks. He works. His neurologist later told his daughter, "If you had waited even 30 minutes longer, your father would likely be paralyzed for life." She later wrote to me and said, "I'm not a doctor. I just remembered 4 letters." Now ask yourself this question honestly. If someone you love has a stroke tomorrow, would you know what to do? FAST detects most strokes, but not all of them. And this is where many lives are lost. Some of the most dangerous strokes do not look dramatic at first. They look harmless, and that is why they are deadly. The first hidden warning sign is a sudden explosive headache. Not a normal headache, not tension, not a migraine. This is often described as the worst headache of my life. It appears within seconds, like a thunderclap, as if something exploded inside the skull. This can indicate a hemorrhagic stroke, where a blood vessel has ruptured and is bleeding. This is an absolute emergency. The second sign is sudden vision loss or visual disturbance. One eye goes dark, vision becomes blurry, double vision appears without explanation. This means the stroke is affecting the visual processing centers of the brain. The third sign is severe dizziness combined with loss of balance. Not mild lightheadedness. The room spins violently. The person cannot walk straight or stand without falling. This often indicates a stroke in the cerebellum, the part of the brain responsible for balance and coordination. The fourth sign is sudden confusion. The person does not know where they are, what day it is, or who the people around them are. In older adults, this is often dismissed as dementia or just age. If confusion appears suddenly, within minutes or hours, it may be a stroke. The fifth sign is numbness or tingling on one side of the body. An arm, a leg, or an entire side suddenly feels heavy, disconnected, or numb. The sixth sign is difficulty swallowing. The person suddenly cannot swallow saliva or begins choking easily. This can indicate a brainstem stroke, one of the most dangerous locations. The seventh sign is sudden nausea and vomiting without food poisoning or illness, especially when combined with other symptoms. Now listen very carefully. Sometimes the symptoms appear and then disappear. The arm works again, speech returns to normal, vision clears. The person thinks, "That was strange, but I'm fine now." This is one of the most fatal mistakes people make. What just happened may have been a TIA, a transient ischemic attack, often called a mini-stroke. This is not a minor event. This is your brain sending a final warning, a cry for help. 40% of people who experience a TIA and ignore it will suffer a major stroke within 3 months. 40%. I treated a man named Roberto. He was 68 years old. One Sunday afternoon, his right arm suddenly stopped responding. 5 minutes later, it returned to normal. He told no one. 2 weeks later, he suffered a massive stroke, permanent paralysis. His neurologist later told him, "That first episode was your warning. If you had come in that day, we could have prevented this." If symptoms appear, even briefly, you go to the emergency room immediately. You do not wait. You do not sleep it off. You do not assume it was nothing. Now I want you to memorize the emergency protocol. If someone is having a stroke in front of you, first 15 seconds, perform fast. Face, arms, speech. One positive sign is enough. Next 15 to 60 seconds, call 911. Say clearly, "This person is having a stroke. Symptoms started at this exact time. We are at this location." Write down the time symptoms began. This is critical. While waiting for the ambulance, lay the person down with the head slightly elevated, about 15 to 30 degrees. Loosen tight clothing. If they vomit, turn them on their side. Speak calmly. Reassure them. Do not give food. Do not give water. Do not give medication. Do not drive them yourself. Now hear this truth clearly. 80% of strokes should never happen. They are preventable. The number one enemy is high blood pressure. High blood pressure causes nearly half of all strokes. Ideal blood pressure should be below 120/80. High blood pressure is silent. You feel fine until it destroys your brain. Never ignore medication because you feel okay. The second enemy is diabetes. Uncontrolled blood sugar damages brain arteries. Keep HbA1c under control. The third enemy is high cholesterol, especially LDL. It creates plaque in brain arteries just like rust inside a pipe. The fourth enemy is smoking. Smoking triples stroke risk. 2 years after quitting, risk drops by half. Let me tell you about Teresa. She was 65 years old. High blood pressure, diabetes, high cholesterol, obesity, smoking. Her doctor told her, "You are months away from a major stroke." She changed everything. She quit smoking. She walked daily. She took her medication seriously. 1 year later, her stroke risk dropped from 45% to 8%. She later wrote to me, "I thought it was too late at my age. I was wrong." It is never too late. Now here is what you must do today. Teach fast to your family this weekend. Practice it. Make it automatic. Create a medical information card. Name, conditions, medications, allergies, emergency contacts. Keep it in your wallet and by your bed. Post fast reminders in your home, refrigerator, bathroom, bedroom. Set up emergency medical information on your phone. Paramedics can access it even when your phone is locked. Run a drill every 6 months. Families who do this save lives. I have seen it with my own eyes. When we began this video, someone in the world lost the ability to speak forever. During the time you have been watching, dozens more have had strokes. Some arrived in time, some did not. The difference was not luck, it was knowledge. You now have that knowledge. 4 letters, 3 hours, 80% preventable. Now it is your responsibility to use it. Protect your brain, act fast.